I want to touch on, obviously, as a digital entrepreneur and having digitized one element of, the health service around sort of staffing. Well, what's your view around, the extent that digitization of clinical pathways, healthcare, how far can it go? Could it go? I mean, obviously it's not the solution to everything, but there are certain areas where some elements, your great example, can make a massive difference.
Yeah, no, absolutely. And I think if we focus on clinical pathways mostly, and I've got some understanding of public health, prevention, and epidemiology and such from various degrees that I've done. But if we focus on prevention as being the key area, primary and secondary, that is where I feel digital health can be the most impactful. I think once you are sick, as anybody, you will likely do best in a center of health where you have people there who can touch, feel, do what they need to do there and then, do whatever tests they can. But it's before that. It's how can we be clever with digital health, digital therapeutics to prevent you getting to that point. And, whether it's fingerprint blood tests like PocDoc or, lipid profiles, you can address things well in the future by easy to do things at home, which will trigger treatment pathways, which could also be done remotely, where you can make a real impact before we get to the point where somebody needs to go to hospital. If I had to put all my eggs in one basket, I would look at digital therapeutics, digital health, treat people before they get sick. So focus on prevention.